welcome everybody to Samudra Shakti ONLINE. All right, so tonight we have Jane Norton presenting, and her topic is turning Kleshas into Lakshmis. She is an Anusara certified instructor that has been teaching yoga for over 15 years on the island of Martha's Vineyard. Jane is among the core group of teachers that helped to found the Anusara School of Hatha Yoga in 2012. She specializes in the therapeutic aspect of yoga, helping clients with chronic pain, depression, anxiety, and trauma disorders. Beyond the training required for certification in Anusara Yoga, Jane has studied extensively with Dr. Douglas Brooks and the Breath Body Mind program with Dr. Richard Brown and Dr. Patricia Gerberg, and is a trained patient care volunteer with Hospice of Martha's Vineyard. Jane holds a bachelor's degree in integrative psychology from the University of Massachusetts and is currently pursuing a master's degree in clinical mental health counseling at Goddard College. An adept storyteller, Jane weaves non-dual tantric philosophy into each class seamlessly, effectively integrating the body, mind, and heart. And I'm going to stop my screen share and turn it over to Jane.
Turning Kleshas into Lakshmis is a phrase that I heard my teacher Douglas Brooks use as a metaphor for how individuals can take things that perhaps might be seen as harmful or traumatic and turn that, transmute that into something that's a mark of significance, that is something that's valuable. So I open with this quote: "Until you make the unconscious conscious, it will rule your life and you will call it fate." And that's a quote from the psychologist Carl Jung. And that's what happens with a lot of people who have traumatic experiences and trauma histories, is that they act in ways in their lives and they don't necessarily make the connection between what happened to them and the kleshas, the things that mark them, and how they're living their lives in the present. And the thing about Jung is that he didn't realize that there are actual biological markers in the brain and the body that we know now because of more modern neuroscience. So, and the cool thing is that a lot of the modern neuroscience is really lining up with the yoga science. And so the yogis are right. And so where might you need to be a trauma-informed yoga teacher? And my answer for that is anywhere you teach yoga. Now that could be in your average 60 to 75 or 90-minute public class at a gym or yoga studio. It could be in a specialized area where you're teaching, say, to a group of veterans, or in a homeless shelter, or victims of intimate partner violence shelter, people with substance use disorder. So there are a lot of different places, or even if you're dealing with a private client, particularly in therapeutic issues with chronic pain, it might be that there's something going on there that they have not made the connection to yet. And there's ways we can do this artfully, and there's ways we can do this less than artfully. So this is a woman, Jamie Mara, she writes the decolonizingyoga.com blog. Being a trauma-informed is something that should be part of the education of anyone that's presenting anything to or working with the public. And so a lot of people think that trauma is, or they think of PTSD, post-traumatic stress disorder. Post-traumatic stress disorder has a very specific set of guidelines, diagnostic guidelines. And not everyone who experiences even severe or traumatic stress develops post-traumatic stress disorder. Most people don't. Most people are able to, with social support, with help, they're able to integrate that into their lives and turn those places into Lakshmis without any extra help. Those people are going to be the ones that might show up in your public class, that are reasonably, they don't have any major life issues or anything, but there's stuff happening. And we all know, at least I should speak for myself, I know that things have come up for me emotionally or mentally through the physical practice of Anusara yoga. And I didn't know where that came from sometimes. And the cool thing is you don't have to know where it comes from in order to work with it and move it on. So a klesha is, it's a mark, or it's like a thing that muddies our consciousness. It may distort our vision, and it may make us think or believe things even about ourselves that aren't true. And it may cover our vision so much that we begin to believe that that's who we are. Specifically for children who have experienced a traumatic childhood or a number of adverse childhood experiences, they will tend to maybe embody or take on blame for these kleshas that they don't deserve to do to themselves. They may begin to think that that's who they are. And that's going to color their decisions and their choices as they move through life. But has anybody here ever been to, a flea market or antique show, or bought a piece of furniture or a beautiful piece of artwork that was not brand new? It didn't come from a factory. And what is it about things like that that make them beautiful? It's their unique marks. It's the imperfections. It's the little things that indicate that a human being put their hands to this and made it. Or that this piece of furniture has been loved by generations of a family. And there are, some dog tooth marks on the side of the foot of the table or whatever, but like, that's the stuff that really makes it different and unique. That's the stuff that makes it shine. And so Lakshmi, of course, she sits upon a lotus, and she's beautiful. She's the embodiment of fulfilled, radiant goddess consciousness. She's the bling. And but she sits on a lotus, and a lotus is rooted down in the muck. Lotuses don't grow unless they have dirty, icky, yucky stuff to grow out of. That's the good stuff. And so what we want to do with our yoga students is maybe help facilitate their ability to have a journey that goes from the muck, from thinking that that's who they are, into who they really can be. And as yoga teachers, we do have to be mindful of our scope of practice. Unless any of you are, practicing psychotherapists or social workers, I back off on that. But I'm sure if you've been teaching for a while, you've witnessed these transformations that came about, not just because of your teaching, but or not just because of what you offer, but for whatever reason, it has been part of this person's journey to wholeness. And if you've had that opportunity, it's a wonderful thing to see. And if you haven't yet, it will happen. Just keep teaching the way you've been taught. It'll happen. So there's our girl. And any questions yet? Anybody have any questions? You seeing anything in the chat room, Notary? Okay. So the thing about trauma-informed yoga, and I had a problem with it when I started to research it as a graduate student, because the programs that I read about, or the books that I read about, I could tell they came from a different philosophical viewpoint than what we come from. They came from a more classical perspective, and they were extremely non-directive. And that differed with my own experience as a student and a teacher of the benefits of our method. And so I think we have something going for us that other styles of yoga or other approaches don't necessarily have. And that's the unique combination of this non-dual philosophy of absolute intrinsic goodness and auspiciousness, along with these principles of alignment that we can use to help people stay safe in their bodies while they're having kind of this psychic and emotional journey. And that's really important, because the most important thing we can do for people who have a trauma background, and for women who are 18 years of age or older in this country, 1 in 4 will be sexually assaulted. 1 in 6 men at that point. So just about there's a lot out there. Whether or not it's a diagnosable condition, it's something that we can help people with. And okay, so this is going to be the geeky stuff, neurobiology, and I will share this document with folks, and I can send you links to more information if you want some more of the information. So we're human beings, we're animals, we have this brain and this body, and we've evolved for millions of years to be the way we are. Parts of our being are still kind of stuck back a few million years ago, and they may react faster than our more modern brains can kind of think and react in a situation. So just for a moment, imagine you're walking through your neighborhood and a bear jumps out at you from behind the bushes. Right? Scary. Now, if that happens, before you can think about it, your fight or flight response will kick in, and neurotransmitters, these chemicals in your brain, will release into your body to help you get ready to run away from the bear. And that's a good thing. That's supposed to happen. Most of us, though, don't run into bears. Well, majority, you live in Colorado, so maybe, I don't know, but we don't have any bears here in Martha's Vineyard. But we all have situations in life that this happens to us. I mean, it could be somebody slamming their brakes on in front of us, and we have to, just that reaction right there, there is cortisol released into your bloodstream, and that's going to float around for a little while, and your muscles tense up, because that is designed to help you get out of a dangerous place, a dangerous situation. That's a good thing. But most of us live with low-grade chronic stress on top of maybe some lifetime trauma. What happens is that our muscles, particularly the smooth muscles of the body and the connective tissue, the fascia, they get used to that heightened sense of, and they kind of fossilize into patterns of moving and behaving that aren't helpful. So that's why we have folks with low back pain all the time, and other things too. This even goes into like heart disease, diabetes, all kinds of illnesses. So the thing about yoga is that we want to put people into a place where they can start to kind of feel and unwind some of that that knotted up stuff that happens that's not necessarily accurate for the present. So I'll skip some of this stuff, but there's a part of our brain called the amygdala. And I don't know if you've ever heard of the amygdala. It's an almond-shaped organ, and it's also present not just in human beings and other mammals, but even reptiles have it. So it's a very old part of our nervous system, and it reacts faster than just about anything does. And so people who have experienced chronic stress or traumatic stress, sometimes the amygdala will jump into action when it doesn't have to. When it's not really a bear jumping out behind the woods, it's our buddy Doc Savage jumping out at us, or who's wearing a bear suit. It's not a real threat, it's a perceived threat. But the nervous system doesn't get that memo, and it still reacts with the body the same way it does if it's a really scary situation. So a lot of times people are coming with that kind of load into our yoga classes, whether they know it or not. So the other thing too is that our brain, luckily, is plastic. It's neuroplastic. It can change. And even if we have had a situation in our lives that's pre-programming us to kind of go down this pathway of reacting in a fearful way, it doesn't have to stay that way. And that's the really good news, because just about everybody with the right treatment and support can find a measure of peace in their lives, even with severe trauma histories. And some of the factors that can mitigate this are also common to like Anusara yoga, because I don't know if you've ever been to a yoga class where social silence was something that was expected or stressed, or been to a yoga studio where when you walk in, you don't talk, you get your mat and your blanket and you go in the studio and you do your practice, and then you put your coat on and you leave. a studio that I teach at, and this woman was a senior teacher trainer at Kripalu for many years. That's how she teaches her classes. There's not a lot of interaction there. And social support and social interaction is one of the most important things that we can encourage in our classes to help people's nervous systems feel safe and be able to self-regulate. So when you walk into the hallway after one of my classes at the same yoga studio, it's a different experience than when you walk into hers. And there's nothing wrong with the way she's teaching. It's just that if we're trying to help people break through their old ways of being that aren't helping them, there are some unique or more Anusara type things we have to offer that other styles don't. So we have those benefits. And so there's a lot of information on the internet, and I'm happy to have conversations with people afterwards to give you more information as we go along, or after this. And I did not create a list of citations for this presentation, sorry. So what can happen though to really reinforce that neuroplasticity? And this is from a student of mine who has a significant trauma history, who's also a yoga teacher. She's a somatic experiencing and biodynamic craniosacral practitioner, and she's on her way. She's on a very similar educational path as me. And I said to her, well, I've actually borrowed her book on trauma-informed yoga. She's the one I borrowed it from. I said, so what they do is very different than what we do. And why do you feel what we do works in Anusara? And she's an Anusara student. She's not an Anusara teacher. And she said, well, I know what to expect. It's safe. Now, that doesn't mean that every one of my classes is the same. And it certainly doesn't mean that, and she's a young woman who can, put her leg behind her head. She's the one I sometimes go to for demos because I can't do that, but she can. And she's like, I said, well, what do you mean? She said, well, the principles are the same. The poses are different. The sequence is different, but it kind of has the same structure, the same flow. And I know I'm going to be safe. Even if we go somewhere different, it's okay, because I know this is for 90 minutes. I'm going to get over it, and then I'll be onto something else. And so that idea of creating physical safety, I thought was very important. And she also said that, one of the more common features or things that happen to people who have trauma backgrounds is a phenomenon called dissociation. Now, in the highest level, that's dissociative disorder, where people have more than one personality living inside their body. And that develops because they need a place to go to hide away from the pain that they experienced. That's really uncommon. But what's more common is just dissociating from any difficult or stressful situation. People zone out. And my friend said, I said, well, okay, what about a vinyasa class or an Ashtanga class? She's like, that's great for me, because then I can just dissociate completely from my body. My body is moving and doing the things the teachers are telling me to do, but my brain is somewhere else. And she said, you don't let us get away with that. You make us think too much. You make us think about our different parts of our body, what we're feeling, where is it, and how can we move it? And what happens if we move our foot another inch further back and deep in the front knee just a little more? Now expand from that place of power. She's like, it's you don't let us dissociate. We have to stay present for the most part. So, and I think that's a combination of the way we teach the alignment principles, and also the underlying philosophy, which is we're all good. It's all good. It's the attitude. It's opening to grace and setting a steady foundation. Teaching people to look for what's good first, and letting them know that doesn't mean everything's good, because especially for people who have a trauma background, there's been some things that aren't so good in their life. Maybe some horrible things, horrific things. And we don't want to create, we don't go in there and be like Pollyanna and be like, oh, it's all good and everything's fine. No, nuh-uh. But while they're in your yoga class, while they're in that room for that period of time, there's probably something good they can find. And that can help reframe the negative thinking, which is part of the neuroplasticity and creating new ways of thinking and moving in the body, which is pretty powerful. And that helps everybody. Doesn't even, I mean, if you say you have a bad day, like you have a fight with your husband or something like that, you come in, somebody can reframe the argument. It doesn't have to be from a trauma background. But the thing is that we're touching people in ways that are really profound and can be really positive the better we get at this. So, and our alignment principles can help people stay safe if we articulate them clearly, and also give people the opportunity to expand their practice when they're ready, to take a risk when it's safe, because a lot of people with trauma backgrounds will be risk averse in ways that won't help them in their yoga practice. You know, they'll never want to try an inversion or a full back bend because they've never done it before. But, you know, and if people defer that, you know, they don't want to do that, like, you don't have to push people, but watch for the ones that are like, they always step back and they're like, can I try that? Then you're on, then you've got them. And our yoga is the householder's yoga. We turn toward life. We do not deny that there is a lot of horrible things happening in our world right now and in the past. But for the time that they're in your class, that's not happening to them. So that's a big thing. And by taking that risk, by maybe coming back to class and watching somebody do a back bend or a handstand with support or whatever, and then they take a little step closer to it, that not only is good for neuroplasticity and changing the way they think about themselves, you're giving them an environment that is allows them to become physically and mentally empowered in a way that's really helpful. A lot of yoga classes for trauma are very non-directive. They will not say, take your feet wide, take your arms out to the side, and turn your left toes out, and bend your left knee into a square into Virabhadrasana 2. They would say, if you would like to, turn your left toes out and bend your knee and see how that feels. It'd be very passive language. And there's a school of thought about that. If you are working with a group of severely traumatized, particularly young people, or people who are traumatized, say, in like a hostage or kidnapping situation where they had no control, sex trafficking victims where they really had no physical control over their physical body and had to do what other people told them in horrible ways over and over again, they may benefit from a non-directive approach to a certain extent. But there's something about, I believe, in creating an atmosphere that allows you to do a directive approach that creates a sense of safety and empowerment in their bodies that's going to create more healing than kind of a, if you want to, try this. So, and I read an anecdote about a woman who taught at a group of young women in a treatment facility, adolescent girls. And one girl was doing triangle pose, and the instructor knew that she was going to hurt herself. She kept going to go wider and wider and wider or something. And the instructor knew, like, if she keeps going, she's going to twist her ankle or something. And, but because of their method, she didn't say anything to this young woman. And the young woman fell and hurt herself, predictably. But their thought is that we do not want to intervene at all on another person's body or on the yoga mat. There's no touch, there's nothing. And I was like, that to me sounds like professional, like malpractice. Like, I don't want anybody to hurt themselves in my class. So, and it could be another trauma. So that's what I'm talking about. We have different philosophical viewpoints. I'm like, I just cannot see the benefit of going to that extreme. But that's how they do it. So, and how are we doing? Any questions? We good?
Yeah. Hi, Jane. You know, we can probably circle around to this at the end, but there seems to be some comments about social silence, which is a new term. This is by Lisa Long, and so she's kind of talking, I don't know if this is the time to insert this, but she's talking about her classes and when social is appropriate, when it's not, how do you hold the seat of the
Right.
teacher when, you know, and this kind of I guess a line to walk.
Right.
And then collaborative and co-creation in the classes she finds really helpful. She says too, as a teacher, it can be hard to manage though.
Mm-hmm.
Do you have any tips of maintaining the sit of the teacher while also allowing this kind of delightful connection and communication pre, during, and post class? So if you had
Great
some
question.
ideas on that.
So the studio that I teach at also has a couple of bodywork rooms down the hall. And when there's bodywork in session, they have some velvet curtains and there's a sign. Inevitably, and it depends, you know, I live in a resort area. So in the summer, like sometimes there's 40 people in the hallway. This time of year, maybe there's 6. When there's 40 people in the hall, it's just hard to keep that many people quiet. And we have to go through the room and be like, inside voices, body work. And people get it. Even if you say insist on social silence, it's hard to keep that many people from making noise. However, in their classroom, one thing that I've found helpful is and I guess it's not just like the social silence or the energy of people in the room in class or after class. It's watching or helping to engage or foster relationships between yogis outside of class. So when I see people that have been coming to class for a while that I know didn't know each other 6 months ago, and they're like, hey, let's go for dinner after class. I'm like, excellent. You know, we're building Kula. But the one thing that I use is my tingsha bells. And that's a good the thing too, because when you start to do, like, say, a partner pose or an inversion, and you partner, the volume just goes up. And that's something I learned from Deb Neubauer in my teacher training. It's just like, I really only use them at the end of class to take people out of Shavasana, but a couple of good bing, bing is enough to get everybody's attention. And so yeah, it is hard to strike that balance. And there are times, there are even certain students that I know when I see them next to each other in the room, I do not necessarily want to encourage them to work together. I might even say, Carolyn, can you work with Galen and Bill over there in the corner? Because I know if she goes with her friend, the volume's just going to go up and they're not going to be able to break out of that. So that's just because I know them, but it's harder if it's a different, if it's a new student that you don't know. Was that helpful at all? Because also the thing about the sound is voice is important, especially when you work with a traumatized population. The tone of voice is important. And I don't think that the overly soft, whispery voice, the yoga voice, is necessarily helpful. Barking like a drill sergeant isn't either. So having a voice that's grounded in your own being, that you can project in a way that people sense your authenticity, is helpful as well. But it can be different too if you're working with adolescents, and I don't do a lot of work with adolescents for a lot of reasons. I found, and my friend Primo Lombardi, our old friend Primo, who's not here, used to teach here at the jail. And we do have a jail here in Martha's Vineyard. The first time he went in, and anybody that's in a jail, chances are they have a trauma history. Being arrested is a traumatic experience for everybody. And the reason they get arrested, there's probably a trauma history behind that. So he went in the first week, and he put mats down on the floor, and the guys were like sitting in chairs on the side of the room. They're like, oh, we have to do this. And he got them to kind of go through a practice. Wasn't that great? But whatever. He went back the next week, and they had the mat set out, and he didn't say anything. He just busted into like Bakasana, headstand, Bakasana, and they were like, "Whoa, how can we learn how to do that?" So there are a lot of ways that you can get people's attention that aren't necessarily verbal, and doing it in a way that's non-threatening is helpful. So that's why he could have come in and been primo and barked at them and said, "Hey, you guys gotta sit down. We're gonna start doing yoga." But he didn't do that. He's like, he just walked in and showed them what was possible in a way that they could understand that was visual rather than verbal. So, so I hope that was helpful. So in a public class, a couple of things, and this is, an issue that's been coming up in the yoga world, especially, since I like to think that we were the pre-Me Too yoga school. And so we've had these conversations, and the studio I work in, I'm the only Anusara teacher, and we've had conversations about, what do we do about touch, and do we get like these flip chips? Do you guys know what flip chips are? It says yes or no about whether you're willing to have a physical assist or not. Or willing to be touched. And there are some yoga studios who have banned, teachers from touching their students at all. And I think on the one hand, the flip chips create an atmosphere of safety, but there's a bit of shame possibly involved because you are identifying yourself as someone who might be different than others. And for somebody with a trauma background, you cannot assume that they're capable of vocalizing or even acting in a way that's in accordance with their actual desire. So if they walk in the room and they see everybody's chip is flipped to yes, they don't want to be the only no. They don't want to call attention to themselves. So they're going to deny what they really want and turn it over. I also think that touch is an important part of helping people get re-embodied in a positive way. And that's a very important part of healing from trauma. So, so I don't think either of those two spectrums are helpful. What I used to do was to, at the end of our invocation, I'd ask you to keep your eyes closed, but release their hands. And then I would say that as I move around the room, I offer hands-on assist and adjustments, and sometimes we partner up with people, but if today is a day you do not wish to do that, please raise your hand. And then a friend of mine said, what about a positive opt-in? And so I've been working on this for a while, and it's really hard to change my language because I'm so used to saying the same thing, where I do the same thing, but then I say, as I move around, and I do this because I have, where I work, like I said, it's a tourist environment. So all summer long, I may have 35 people in my Saturday morning class, and I know 3 of them. And some of them maybe that'll be there for 2 weeks. Some of them will be there 1 day, and I'll never see them again because they're never coming back here. So what I do is ask people to, I'll say I move around the room. I will, and I get people's names. That's really important because getting their name, making eye contact, introducing yourself is something that a lot of people have not experienced in a yoga class. And that really makes them feel seen and heard and like they're important, I think. And because I have maybe 35 people in the room that I've never met before, except for 3 of them, I bring a piece of paper and a pen. And as I walk around the room, as people put their mats down, I write their names down so that I can say, hey, Bob, yeah, you in the back row, move your right leg a little more. And that helps people feel seen and heard in a way that's also positive. But I will say, as I move around the room, I offer hands-on assistance adjustments. Sometimes we partner up with someone. This is something that may make your practice feel complete. If this will make your practice feel complete today, please raise your hand to opt in to adjustments and assists. And it's a little odd. I'm still not sold on the language. I've got to get it down a little bit more, but giving people the opportunity to say yes or no in a way that nobody else can see but me, I think has empowered people that even irregular students, once in a while, they raise their hand that they would raise their hand that they didn't want, or they won't raise their hand now. I'm like, all right, well, something's going on for them today. So I know I'm not going to give Carolyn any assists. Most days she likes them, but maybe not today, and that's okay. And and reviewing like basic safety stuff about the yoga for every class when somebody new comes in, saying like, it's okay to leave if you need to leave. It's okay to take child's pose. You can pause or just watch, you know. And so, and the same thing with assists and adjustments, especially anything where you're gonna be touching a potentially sensitive area of the body. I would definitely demonstrate that in front of the class with a student I know fairly well that I've done this with before. Say if I'm going to do like an inner spiral adjustment, we roll the top of the thigh back on the back leg, say of a warrior Parsvakonasana, because you want to see, you're showing people what you're doing and you can tell them why you're doing it and why it's important. And a lot of people, even with a trauma background, who would be averse to touch from someone, especially somebody coming from behind, if you tell them why you're doing it, why it's important, and they can see what's happening in somebody else's body, they're, oh, okay. And this is an important way of helping people learn that there's good and bad touch, and there's good and bad ways of doing things. And they don't have to shut themselves off from the whole spectrum of life. And they're empowered to say yes or no or opt in. So, and being available to your students afterwards to talk and getting to know them helps, because you'll see with some students, they maybe have an exaggerated startle response, and you don't have to touch that, you don't have to mention it, but you see it, and then just know that this person might benefit from having a sandbag on their thighs during Shavasana, because if there's a truck in the parking lot that backfires, they're going to jump, and that might help them get more grounded. So just being authentic. And special populations, like I said, assume that there's a trauma background for everybody. And they may not know it, and it may not be a trauma disorder, but if you're going to find people in special population, chances are that there's a reason they got there, and it probably wasn't pleasant. And I would avoid touch in those situations at the beginning, at the outset, except for like a handshake, until you build a rapport. And until you know the group, and also until you understand the rules of the facility, because it may be that it's absolutely not okay for someone that's not a licensed professional or who's insured by the facility to touch any of the people that live there or visit there. So, and the other thing is setting the room up with, it might be, say if you're in a VA, a Veterans Administration place, or say a place for domestic violence survivors, let them put their mats up against the wall and face the center of the room, so that they can see the exits and the entrances. And it might be you don't have to do that all the time, because if you can build that container of safety and they can trust you, then they're going to be willing to kind of take little bits of risks. And when that's a great way of like starting from a place, a baseline. It gives you places to go from there to grow as people are ready. Things like certain pranayamas and meditation techniques can be triggering for people with trauma backgrounds. Certain guided meditations where, because if your defense mechanism when you were being abused or something was to kind of drift away into a different place, to dissociate, a guided meditation may it kind of does the same thing. For those of us that aren't suffering from that issue, it's a positive thing. But for somebody with that background that doesn't necessarily understand the difference between the two, it may put them in a place that seems too eerily familiar to what they had to do in order to survive. So that's where I think some of the more directive ways of doing things are helpful, in little small bites. And the unconditional positive regard, which is kind of a hallmark of most modern psychotherapy, is look for the good and compliment, notice, way to go, atta girl, whatever, like as much as you can in a way that's meaningful and genuine. Because a lot of these people do not get that information they haven't gotten it from people in their lives, and everybody needs it. So look for the good first. And then with private clients, I do a lot of work with private clients with yoga therapy, and it doesn't take too long for me to figure out, oh, there's something going on here that's far below. Well, it's not far below, it's in their consciousness, but there's a connection that their mind, heart, and body are not making. And a lot of psoas issues, and lower back stuff, and trigger point. That's why I'm looking forward to Adam's presentation, because I want to learn more about the fascia, and that is really like a conductor. The fascia helps to conduct some of these stress hormones that go through our body. It's like a superconductor. And there's a lot of wisdom there in the body and a lot of memory. And we have the unique ability to kind of maybe help people put those things together. And but you have to be mindful of your scope of practice, because you don't want to say like, I know your psoas is type, but really I think you need to go to therapy. Maybe that's what you think, and maybe that would help. That's not our job to make a diagnosis or to make those types of suggestions. So a lot of what I have done for people who I work with, who I know are suffering from physical ailments, but I think there's a deeper connection to other parts of their body, is, I might talk about the gunas, or I might talk about the koshas, and how in the yogic mind we have this connection and this pathway of information from the subtle to the gross and back again, and it's all connected and it's all permeable. And they may hear something in that would make them think about other experiences in their lives that is non-threatening and non-blaming, and it's not specific to whatever they went through, because we don't need to know what that was in order to help them, which is very cool. And I should show you a text message I got from a friend on Friday. I've been working with this one for 5 years. I don't know. We didn't do anything different on Friday. I don't know what happened, but for whatever reason, something shifted. And this is a woman whose primary care physician said to her a couple months ago, I don't know, maybe you need to go to therapy, go see a therapist. Maybe it's all in your head. And she was very upset about that. And I didn't say anything, even though I think she would benefit from it, but that's not my job to say that. So it was really nice to see that happen. And again, I don't know what happened to her, whatever, but like, I don't have to. Like, we just line ourselves up, open a grace, and let the Shakti come in. And to have that be effective, we have to create safety for the client. And that is what really, that's the magic, I think. So I think, and they might want to share some of their background, and if they do, you can listen. If it's uncomfortable for you because maybe you're not prepared to hear this, or maybe it's triggering your own issues, you can perhaps say, you know what, this may not be helpful for our work together. I understand that you've gone through something difficult. Let's see what we can do to continue to help you heal. So that can be helpful as well.